Hi everyone, I'm Mark Houston. Welcome back to Doc Talk with Monument Health. Today we're on East Mall Drive at the brand new Monument Health Emergency Room. Dr. Brook Eide is back with me and he's giving us a behind the scenes tour before the doors officially open. We'll walk through the St. Barbara Chapel, the ambulance bay, the trauma room, the CT scanner, the lab, and the central hub where the team will keep an eye on every patient. Brook will explain what this new ER can do, what still has to happen at the main hospital, and why having a facility like this on the east side matters as Rapid City keeps growing. So come along with us. Let's take a look.
Hello again, Dr. Eide.
Good to see you. Thanks for coming out.
Well, new place here.
All this new car smell out here right now.
Isn't that great? I agree. You just walk in and it feels fresh and new and ready to go.
Well, we're here because this is going to be the brand new emergency room for Monument Health. This is the one that's been in the works. If you drove down the interstate, you saw the sign, coming soon. This was going to be big and exciting.
Yeah.
And I can't imagine for you how this feels to have something like this open now in this part of Rapid City.
It's exciting. As you can see, we're still bringing stuff in. We're still getting ready for the first big day here, but we'll be ready to go soon. And we're excited. I'm excited to show it to you today.
I would love to go have a look. Let's go walk around, Doctor.
Let's go this way and I'll show you where we come in. We come in this way as the front door and I'll show you the ambulance bay and we'll just kind of walk through it.
Excellent.
Come on in. So we've got that beautiful waiting room you saw, but we also have this room, and this is our St. Barbara Chapel, as we call it. And this is a room just to come if your family's getting tests done, if you need a moment to kind of sit and relax and have just a nice area. Families could gather here. And so it's just a beautiful space. And we have this space because the Lean family sold us this land, and they were very generous. And what part of that was that we would build this chapel to honor Barbara Lean. And so this is our St. Barbara Chapel, and it's going to be a great place for patients and staff really just to come and get a quiet moment and relax.
Again, it's a beautiful room, beautiful space. And I think it's needed in an emergency room and in situations where people are stressed and panicked and anxiety and where they can just sit down a second and kind of collect themselves.
It's also nice. Sometimes we get bad news in the emergency department. And it's nice to have a nice quiet space, just to let families kind of soak that in and to talk with them and not have that chaos.
All right, Doctor. Well, now we are heading to the brand new ambulance bay here at this new emergency room. And I remember from last time we talked at the emergency room that's downtown in Rapid City. That one is huge.
Yeah.
You said we can get how many ambulances in and out of there?
We can get 8 to 10 ambulances in there. So yeah, that one's made for busy full service ambulance. You'll see a little different thing here where we're looking more at not a lot of ambulances coming in, probably more going out if we need to go back to our main shop, but a much lower ambulance volume.
All right, well, let's go take a look and see what it's like. Well, Doctor, here we are in the brand new ambulance area here at the emergency room on East Mall Drive, and this is considerably smaller than the one you will find downtown at Monument Health, right? So this will be, you mentioned a little bit earlier that this might be more for coming than going in this bay.
So this site, a lot of our ambulances come in, and ambulance will bring very sick patients often. So a lot of those are going to go to our main hospital where we have all the resources like we talked about last time.
Yeah.
But there'll be times that people are going to come here and we're going to find something on them that's a true emergency that needs maybe a surgeon, maybe our heart doctors. And so they'll be coming out of here a lot. And then maybe some coming in as well, but a lot coming out. And so that's kind of where we see this. So it's going to not near the traffic of the other place. And so the same nice service was built this way where you come in one door and out the other. They're not backing in, they're not backing out. And it's a very nice ambulance bay. It's nicer than the one we had at the old hospital, to be honest with you. But it's nothing like we have at the main hospital, and it won't have near the service and level of ambulances coming through it.
Well, what I noticed and what I really, I think it's obviously well planned is that if you are coming in here and you're getting off the ambulance, the room that they're going to take you to is steps away, which I think can make a big difference for somebody coming off that ambulance.
Absolutely. Even though we're a smaller scale here, we're set up when we have to deliver that same high quality of care where our ambulance bay here is across the hall to our trauma room, which is set up to do all the magical things that we do in a trauma room in Rapid City. Only from there we'll have to package and get over to other specialists. But we're set up here. If you come in, if you're close to the interstate here with the car accident, you're going to come in here and you're going to be in our resuscitation bay quickly and ready for us to work on you. Let's go check it out. Let's have a look. And we'll get I still got my clothes and stuff here. It's just like when you move into a house.
Everything's still boxed up.
My flip-flops are in one of those. I don't know which one.
So this will be the area that they come into. You like you said, that walk across there didn't even take us 6 seconds, I bet.
Yeah.
And when paramedics are moving somebody from that ambulance into here, I think quickness is the key in a lot of instances too, right?
Absolutely. So time is a big thing, and that's one of the things in emergency medicine we talk about time. Time is tissue, time is brain, time is whatever it is. And so we're set up that if we have a sick patient come in here, they're out of the ambulance, they're across the hall here and into this large room you can see where we're set up to have that big work area where we can do procedures and resuscitation and all the magical things that we do in the emergency department, right here in a model version like we have multiple of in the main city.
And what's nice is this is all top of the line. Everything in here is brand new.
Yep.
I mean, state of the art.
Yeah, so lots of time and hours went into figuring out what we need in these rooms to kind of model it after our main ED to say, these are the things that we need to do. We need to have, even if we don't use them a lot, we have them here and we're ready for that patient.
All right, let's go take a look at some of the rest of the stuff that's in this brand new emergency facility here on East Mall Drive. So one thing I noticed, Doctor, in this new facility, and I'm sure these happen in most emergency rooms or hospitals, is let's say we're in Rapid City, we're in South Dakota, there's going to be a blizzard at some point, right? You guys have a place that you can kind of quickly regroup and recoup, but you're here, you're ready to go. But there's rooms here for you guys to kind of go in, sit down for a minute, and just wait for what's about to roll in again, correct?
Absolutely. So this is a place that's great for patients, but great for our staff too. You'll see we have a nice little staff break room where you can have a break and get some food. We have a room here that's a sleep room that, I'll tell you during Atlas, I'm old enough that I worked during Atlas and I spent 4 days at the hospital stuck there. And so it's nice to have a place you can slip off and get a little sleep. And so we have a little sleep room here. It's not the Grand Hyatt, but it's a place to catch a few Z's.
One thing I want is my ER doctors rested, okay? So that's good to know.
Yeah.
All right, doctor, we have just been in the ambulance bay. We've been on that side of the facility. And you said as we came in that people and patients will end up going kind of in both directions when they come into the facility. But I think this will be the main hall where a lot of people will end up generally.
Yeah, so we kind of modeled this after our emergency department, as you remember, around the city, where we have this outer hub, and this is where patients will be. And then we'll come later into the inner hub, which is where our care workers will be at. And so we can, 2 rooms each door, so we can keep kind of the medical stuff on that side and the patients out here. And so this is kind of the other hallway. We have a lot more stuff here. We have our staff break room, and then we'll have lab and imaging. We'll see as we go down further. And so those will be some nice things that we can bring people out of a room or out of a room there in this hallway to get those things done while we maintain that kind of privacy of the center area.
Now, what are some of the things that this place specifically can't do, like downtown, the main hospital can't?
Yeah, there's going to be some limitations on some of the imaging that we do. We're going to have CAT scan, the main imaging, we're X-rays, we're ultrasound sometimes not, because that's kind of a lesser used modality of imaging. And then as far as the physicians, the same doc here, I might be here today and at the main shop tomorrow. So we're gonna have that same high quality, always have a board certified ER doctor here. So that will be there. We'll have nurses in here that share with the main hospital. So the same expertise will be here, just some of those resources will be a little bit different. And then probably the biggest thing will be that we won't have MRI here and we won't have a lot of specialists here. And so if you do come in and you're having that heart attack, we're going to do the first part of it, but now we need to get you that heart doctor, and that's going to be in the ambulance and over to the main hospital.
Well, I wanted to go into the X-ray radiation room here because I believe this is the room that does have your CT scan machine in here, correct?
Yeah, absolutely.
All right, let's go take a look. I've never seen one brand new before. Boy, that still has the plastic on it.
Yeah, right.
This machine
has the floor mats that say been detailed.
So what is the difference between a CT scan and an MRI?
Yeah, so a CT scan uses, as you saw the big sign there, it uses nuclear medicine. It uses radiation, and there's multiple thin cuts, like an X-ray almost, but there's multiple of them that put together into one big image. Where an MRI uses magnets to develop their images. It takes longer to do, and it's better for different things. MRIs are great for seeing ligaments or seeing joints or those kind of things, where CTs work for us for seeing, the spleen or the pancreas or the brain. So they kind of do different things and have different strengths and weaknesses. But MRI is something used more as a scheduled thing. And CT scan, we do for a lot of our emergency stuff.
Excellent. Well, I don't want to ever be the first one to use a machine like this.
No.
But glad it's here and ready to go.
Yeah, it's a great machine, and we're going to be able to do maybe some outpatient stuff here too to kind of just help the community. And so it'll be well used, and this machine's going to give us great images, just high quality, and going to help us give great medicine to Rapid City.
The urge to touch those screens right now is almost irresistible. So we should probably go.
All right, let's get you out of this. These are expensive if you break them.
So what would be in a room like this then, Doctor? Explain this one a little bit too. This was right next to the room with the CT machine.
Yeah, so this is our X-ray.
Okay.
So this will be doing X-rays. That's just kind of the big X-ray arm there that you can lay down and get X-rays of different things. And so that was done here. And then in the center that we walk through is kind of the command hub, if you notice that. And so much of this now is computer ran.
Yeah.
And to get that perfect images, the computers help us do that. And our technicians are super skilled, but they use these computers. And it's kind of one of those things like most jobs where it used to be more of a physical thing, and now you got to know your computers to run any of this stuff. So it's all very high tech, but gives us great images that really helps us take care of people.
So Doctor, you mentioned that labs can be done here too, obviously. If somebody comes in and needs emergency treatment, that's one of the things you want to be able to do. And so the room here with the lab still getting set up with lots of people that are way smarter.
So this is the lab. You can see it's super high tech.
It is.
And one of the things that has to be done before we can open is that lots of quality assurance in all these new machines, right? To make sure that we're getting accurate lab tests to make our decisions off of this. So that's that we're getting set up, we're QAing them all. And this is gonna be a great lab. We will do a lot of things out of this lab, a lot of our emergency tests, but they'll also go do some outpatient lab here. So that will help the community being able to come here to get their cholesterol drawn, right?
So if somebody needs blood work done before they see their doctor, they could make an appointment to come here to do that.
Exactly.
So
that'll be a nice use of it. And then, like I said, when we need it, the labs emergency department will be the number one thing that gets ran and done, and so we can quickly get people their lab tests to determine what we need to do to help them.
Oh, it's so exciting to see all of this getting set up and ready to go.
It is exciting. It's coming quick.
Yes, it is. Well, let's take, again, another quick tour here just into the entrance area.
Yeah.
So again, this is where most people will be coming in if they're not coming in by ambulance. So it's all set up. And again, what I like about this, what I noticed from the renovation at the first hospital, the hospital downtown, there still is, I mean, there's a lot of building and construction, right? But you still manage to bring in that sense of calm that's in here too. I think aesthetically, the way it's made, even the sound as well. Again, when we were here before, it was super busy on the inside. That quietness was still here.
Right.
It's kind of
still maintaining that.
Yeah.
But this hallway will be patients and that stuff. When we get to the inside, you'll see that there will be patients there. But we maintain that same sense of these outer hallways to guide our patients through with our inner core area. And then this great waiting room here that, will be used if you're getting your outpatient labs drawn, you may be here. We're really hoping for emergency patients that we're going to be going right back. And we're going to do what's called direct vetting, where you come in, you tell us your complaint, and we're going to get you to a room right away and get things going. So we're excited about that.
Well, let's go see now where a lot of the magic and monitoring happens too, which is right here in the middle.
Yeah, let's have the peek.
All right, Doctor, let's go see where everything will be monitored extremely close.
So this is...
There we go.
That's why magic hands.
This is why he's a doctor.
So this little room here is a triage room. So if we need to, if we're full, we can bring you in here and kind of figure out what's going on to figure out how to get you back.
Oh, sure. This was similar to
The big triage we have to main hospital. So it's small because our plan is mainly to be able to bring people right back to a room. But if we have to, then we'll be able to do that. Or maybe you can see that's a phlebotomy chair. They can draw blood there to get things started. And so this is just kind of a small area to use if we need to sort through what room we're going to go into.
What specifically makes this a phlebotomy chair? Why is it a specific thing?
Well, it's the arms. And so you got to get your arm up there. And then we can strap you down so you can't, no, I'm just kidding. It's mostly the arms that give them the access to draw that blood, So it goes up and down. And it's similar to, we have eye chairs and nose chairs that do this kind of same thing, where you give them that right position to work on them. And so if you've got your phlebotomists here, you want to build them up to where they're comfortable, where they're not bent over.
Oh, sure.
And get that arm in a good place so they can get that vein and get that blood started.
Yeah, get it out quick.
Get it out, that's right.
I want it in there for a long time.
All right, we're going to go through this one.
All right.
Or you go first.
Okay. So now, again, we're in the, I guess this would be the hub.
Yeah,
Or
the center core, we call it.
Okay.
So this is kind of, we had those outside halls leaking down on both sides of us, and they had doors that went out to the halls, and now there's doors into this area too, and this is where our staff will be working, our doctors and nurses will be working out of this area, being able to see all these people and come back quickly and put stuff in computers and do those things. So this will be a place where we'll have the monitors up again. There's all patient protected, and so we don't have patients here, and that lets us do that.
Well, I noticed in the main hospital downtown, there were television screens everywhere on the walls.
Yeah.
I feel like NASA.
Right.
Is that as needed here in a place like this
So-
because the space is smaller?
Yeah, less needed, and also just a lot less rooms. And so we had those walls of monitors where we had, 20 people maybe on telemetry at a time, or 30. Here we have 9 rooms, and so we need a lot less of that, obviously. But we'll still be able to have that same thing where we can have those up. So if you are out here, we always have an eye on patients, even though they're close.
Yeah.
We have an extra eye on them if we're doing some paperwork here. You can watch them as we're waiting for their evaluation.
Well, thanks again, Doctor, for giving us a tour here of the brand new emergency room on East Mall Drive. When you come to a place like this, after all of your years of being an ER doctor and all of the emergency rooms you've seen, what does it mean to you to get a facility like this? It's brand new, state of the art. I mean, it's got to be exciting. I mean, what you do is already exciting, and it's why you do it. But what does this mean?
Yeah, it's super exciting. This is the first of all the ERs I've worked in, the first one I've ever helped set up and design. And so that was really a fun thing, and really have that input to say, hey, this is what works best. This is how we want to do it. So that's been really fun. And then just to have it done now is exciting, because you always worry, you build a house, you always worry how it's going to end up. It's turned out beautiful. I'm super excited about how everything came together, how everything's going to work, and excited to see the first patient here. So it's coming up soon. And that's when we're really, that's when we're there. But we're close, and it's been a great experience, and this is a great facility, and just really great for Rapid City.
Yeah, I think the location and as Rapid City continues to grow, obviously these are going to be, they're needed. I mean, this is a place where it should help people that feel anxiety or stress about either coming to a place like this or having to be in an ambulance and come to a place like this, having this kind of behind the scenes tour and you explain what's been going on. That really should give a lot of positivity to this community specifically, and how this is going to work. So again, thank you for having me again. Absolutely, yes. I don't ever want to see you in this building.
That's fair.
Outside, absolutely. Okay, that sounds fair.
All right.
We'll do it that way.
All right, thanks a lot.